We're now in the third year of living with the coronavirus, but there's still no end in sight. While global economic growth forecasts have been telling stories of hope, the situation on the ground has been painting quite the ominous picture. The situation is such that when things start to feel normal again, a new variant comes into focus to shake things up once again, the latest being the Omicron variant. To date, more than 500,000 more people have lost their lives since Omicron, which means 500,000 more people lost from the labour market, future economic think tanks and contributors. So when will all of this end? Dr. Kiran Bhagat gives us the latest updates on the pandemic. We want to know where we are now. It's been more than 2 years now, and so what have we learned so far?
I think we're significantly far forward. I mean, I always say to patients that this has to be the most studied vaccine and infection in the history of medicine. Never before has a vaccine or the consequences of the disease been studied more than COVID has. And even accounting for the previous COVIDs we had in the Middle Eastern SARS virus, CoV-1, this is just incredible. And so we have a huge wealth of data in terms of 2022 as to the way forward. I think the way forward is a gradual reduction in the restrictions that we have, and in some countries such as the United Kingdom, the elimination of restrictions. And I think we need to be careful and cautious, because we're not the United Kingdom, as to how we eliminate restrictions and move forward. With that having been said, I think the most important thing that we've learned is that vaccination is a prerequisite. It's not a mandate, but it's certainly something that has been shown to dramatically and drastically reduce the burden that we already have on our health system. In terms of the budgetary expenditure that we had in the last 2 years, everybody knows that, the Ministry of Health asked for large budget allocations for COVID. So I think in terms of the vaccination program, it's vital for people and the population to understand that vaccinations have been a tremendous success. It's important to understand that it is one of the ways, if we want to move forward to almost pre-COVID days, we need to make sure that everybody that needs the vaccine has been vaccinated appropriately and boosted where necessary. That's the first thing. The second thing is we've learned that those that are high risk, like we've talked about in the previous episodes, those that continually need to be careful, the lifestyle measures that we need to undertake in terms of exercise, in terms of diet, in terms of the vaccinations, in terms of eating the right foods, and in terms of making sure that your chronic disease, and a lot of patients out there live with chronic disease. It may simply be a sinus infection or an allergy infection or an asthma. Now it's incumbent on the patient to make sure that they adhere to their treatment. Too often, we have a rule in medicine that we teach to students, that there's a 30% rule, that 30% of patients take 30% of their medicines 30% of the time. The rest of the time they don't take their medicines. So these are things we are teaching our students to say, now emphasize lifestyle measures in terms of the additional baggage you put in your toolkit to make sure patients remain well. Because like we said, COVID is here to stay in whatever variety, whether it's Omicron or the new variation of Omicron. And we're hoping that this is something that eventually becomes part of the community. The other is supportive treatment in terms of supplements. We've learned that, supplements such as vitamin D, such as zinc, natural supplements such as curcumin or turmeric, which is an anti-inflammatory, ginger, garlic, we know these are supportive to the system. We know that a majority of our population are vitamin D deficient. We spend a lot of our time indoors because it's too hot. You don't get enough vitamin D. We know people are deficient in zinc, which is an immunostimulant. So these are things we've been giving patients post-COVID, but we need to make sure that they get their quantities of zinc and vitamin D in adequate amounts. Outdoor play and sport, vitamin C in terms of, natural fruits and vegetables, zinc in terms of nuts and seeds and things we've talked about before. So these are things in terms of nutrition as well as supplements we need to encourage. And the third then, of course, is that of protective gear. We know that masks work. We know that masks that are appropriate will work. Those that walk around with bandanas and cloth masks, we know that they don't work. So if you're going to mask effectively, you need to make sure that you're wearing either a K95 or a KN95 mask, or you wear a surgical mask, a blue mask, which is usually well fitted as well as pinched at the nose. We've seen people that hang their masks below their chin. We've seen people that chew on their masks. We've seen people that actually don't effectively wear masks. you literally are not doing anything except fooling yourself. We know that cloth masks don't work in terms of transmission, particularly with infections like Omicron, which is highly contagious. So that is also another measure in terms of eliminating some of the restrictions, if you like, after the aftermath, if you like. And last but not least, in terms of restrictions, you need to make sure that you are aware that if you have flu, it may be a variation of COVID, stay at home. If you are high risk, go to the hospital and present yourself and test yourself. So in certain situations, you need to learn how to behave so that you are not a public deterrent. You are not going into the office spreading an infection. It may not be COVID, it may be something else. But some of the old-fashioned rules that we said, if you're sick, stay at home. So these are things that we're trying to encourage people to be a little bit more savvy about in terms of looking after themselves as well as being responsible citizens of our country.
Last year, Doctor, when the Delta and, more severe variants of the COVID-19 came out and were wreaking havoc and causing so much damage, there were talks and information coming out about what was referred to as the long COVID syndrome. So I want you now to talk further into that as far as what new information has come out regarding that, and how can people who are presenting with prolonged symptoms of COVID post-infection be helped?
It's a science in evolution, and it is a science that is still being studied. It is important to understand that for those that don't know what long COVID or post-COVID or COVID long syndrome is, it is a condition that occurs in a portion of patients who've overcome the COVID, and it may just be a mild episode of for example, Omicron, but then have longer consequences of the inflammation that the virus produces in the body. We know that there's inflammation in the heart and in the lungs and in the brain, and these consequences are sometimes seen. Patients come and complain of palpitations or chest pain or shortness of breath, and we'll do an x-ray and you can't see anything. Or they'll complain of brain fog, where they get forgetful. Some people get depressed. The younger population we see often are not able to perform and focus at school. In rare situations, you see what are called neurological problems, nerve-related problems. They get numbness in the feet, they get difficulty in walking. And when you do scans of the brain or the heart or the lungs, you begin to see that there's still remnant inflammation that is going on. How one tackles this is still open to science and research. And it is the reason why the WHO recommends that vaccination is one of the ways to prevent. We know that if you are vaccinated, there's a substantially less chance of you getting long COVID. So many of the long COVID situations we see are in patients that are not vaccinated. So it's important to understand that. At the moment, what we're doing, sadly, but it is early days, is to treat it symptomatically. If they come with palpitations, we'll give them something temporarily to slow down the palpitations. If it's insomnia, we'll give them something to help them sleep. If it's confusion, we'll do a brain scan to make sure there's nothing more serious. If it's cough or shortness of breath, we may give them an inhaler. So the moment is symptomatic treatment, but prevention is the cure. It's a penny's worth in terms of a pound of cure is worth a penny of prevention. In other words, it costs much less to prevent it by doing all those lifestyle preventive vaccine measures than getting COVID infection.
Doctor, it's been so long since the outbreak of the coronavirus in 2020 and 2019 in other parts of the world, and people are tired, So I think now we want to know what to expect, regarding policies, regarding vaccines, regarding cures, if you will. So what can we expect moving forward?
We can expect very many positive things, Purnasekaran. I think the most recent exciting data is coming out of two new drugs, Paxlovid and Molnupiravir. These are long-winded names manufactured by companies such as Pfizer and Merck, and these have been shown to have almost a 95% effectiveness in dealing with an acute COVID infection. So we are able to deal with it if somebody comes into hospital. I think the public will become a little bit more aware in terms of being responsible citizens. I think that I do see elimination of many of the restrictions that we had in the last 2 years in our country as well as our neighboring countries. I think people will be able to travel, go to concerts, go to restaurants, but I think with a little bit more sense and sensibility in terms of who they're putting themselves at risk. For example, if you're going to see your granny or grandfather, you need to make sure that you have been vaccinated. You need to make sure that they are vaccinated. You need to make sure that you don't have the flu or flu-like symptoms before you go and visit them.
This program was brought to you in association with First National Bank of Botswana.
FNB, how can we help you?